I'd like to ask now Dr. Ravi Verma, the Regional Director for ICRW, to give us some background on alcohol and domestic violence, which brings us back to another form or factor affecting domestic violence. Ravi Verma is Regional Director for the International Center for Research on Women, the Asia Regional Office in New Delhi. In this role, Dr. Verma leads ICRW's local and regional efforts to conduct research, provide technical support, build capacity, and partake in policy dialogue on an array of issues, including adolescent girls, reproductive health, HIV/AIDS, gender-based violence, and engaging men and boys. Verma brings more than 25 years of programmatic research experience in reproductive health, gender mainstreaming, and HIV in South Asia. Support, build capacity, and partake in policy dialogue on an array of issues, including adolescent girls, reproductive health, HIV/AIDS, gender-based violence, and engaging men and boys. Verma brings more than 25 years of programmatic research experience in reproductive health, gender mainstreaming, and HIV in South Asia. Prior to joining ICRW in 2007, he was a program associate with the Population Council Horizons, where he collaborated with partners to design, implement, and evaluate innovative operations research projects on gender and HIV. So, Dr. Verma, you have the floor. Thank you.
Thank you, Kathleen. And thanks for my introduction seemed to be longer than my presentation. Actually, I'm really embarrassed. I don't have any formal presentation, and I've just shared some of my thoughts on this issue. I was asked to talk about the linkages between alcohol and domestic violence. And this comes from the fact that we at the ICRW have done over the past about 10 years a lot of work around the issues of violence against women, trying to understand the structural determinants and their consequences on many outcomes. And in the course of the exploration of understanding where does this violence come from, we did do a series of work around alcohol and how does alcohol intervene in this paradigm of nexus between violence against women and gender norms on the other hand. And let me tell you that our exploration so far and review of literature does suggest that there's a really serious lack of, there's a dearth of evidence on linking alcohol with the violence against women. We know that they are connected, and alcohol does come out in most lives of women as one of the key determinants or key predictor of violence. But if you dig a little deeper in those narratives, you will find that it is far beyond alcohol. And that's where, and I want you to stay with that idea, that alcohol is per se not a determinant or a predictor of violence, but it is embedded in a much larger context of how gender is constructed, why alcohol is consumed, and where and what the social norms are around drinking and responsible drinking, or alcohol as a means to prove masculinity. So this very, very well links up to the kind of work that we have worked in India to deconstruct the entire notion of gender and gender norms as it operates, and alcohol becomes one of the minor manifestation of the inequitable gender norms. We think that a lot of our work goes back, and I just take this opportunity to describe some of the work that we are doing by way of giving insights in as we understand the dynamic of violence against. About 10 years back, when we did a national survey on violence against women, it became apparent to us that it is the notion of masculinity and how men define manliness is what is determining the different forms of control. And violence against women and domestic violence is one of the key component of that, is not only expressed in the form of physical violence, but has whole range of very nuanced but very profound forms of violences. which ranges from many different techniques of control. And we heard in the previous speaker talking about that installation of fear or even emotional blackmail of various kinds can become means of of control, and that in our view has far more serious implications on the mind, on the well-being of women and girls than just the physical aspect of it. In fact, the proportion those reported physical violence was much less, and over the years we have expanded the definition of violence against women to include all forms of violence to construct the indicator of violence against women, and we understand that it is much more deeper and much more serious than what we think, most of us, by using only physical indicator of it. I think all of us who are concerned about violence against women, and I come from an organization which does primarily research and builds evidence to inform the policies and programs. We think that there's a much more refined, there's a need for much more refined evidence to generate in this field. Otherwise we either become we taken away by, or we are counter-argued by the evidence which is really not, based on hard data. For example, how the notion of gender inequality is socialized is very little, there's very little understanding on that issue of it. When we were working with the older boys and men on ending violence against women, after about 1 year of work in the communities with the groups of men and boys, we realized that we need to shift the complete program to the early age group, because it was too late. By the age of around 29, 30 years working with men and boys, it was evident to us that what they're talking about is something deep rooted in the way they have been socialized during the schools and in the families when they were growing up, and they were putting and our data subsequently showed that many of these boys and men were coming from families which were violent families, where they saw their father beating mother, where they saw the violence as a matter of routine, instrument of disciplining and control. And therefore, it was very difficult to take out violence from the psyche of these men and boys by way of just telling them that it is wrong. It had to be completely deconstructed in the manner they have constructed their own being, their identity as such. And then there were a whole lot of men and boys who felt that they are coerced these norms, but no courage to talk about it, because they would be marginalized in the groups of men and boys. So there was a fear even among the boys and men who are equitable, but they don't want to express themselves as equitable because that is not being manly. So respecting a woman or your partner is not seen as something, is not approved by the norms of men and the peer groups. You need to be seen as controlling in any ways, in different ways, and that's why many men who were questioning this didn't know the appropriate expressions, nor had the appropriate articulation of those means. So we realized that we had to have a couple of different entry points into addressing violence against women and domestic violence in particular. One is that we need to give voices and spaces for the men and boys who are deviant in some ways, and listen to them and see where do they come from, and then see if there is a dissonance in the minds of those who are perpetrating violence but are somewhere uncomfortable about it. Working with men and boys to see the value of being equitable follows a very different trajectory than working with women and girls to empower them on the issues of gender. It's completely two different trajectories actually. Because men and boys to realize that they have by becoming equitable, they are not losing, but they're gaining. It follows a different logic, which is in the conventional patriarchal society. It's very difficult for men to believe that why should they give up aggression, because aggression has been part of the making of their being. They have learned as a growing boy that by being aggressive and by being competitive, you are achieving the standard of excellence actually. So the aggression and violence becomes a tool for achievements. And and we started working in the schools. We knew that this whole idea of excelling in society, in your life, comes from the school system, where school, in my view, in our views, who are working in this area, is the prime institution for violence promotion actually. Because in Indian schools, I can guarantee that, because the hierarchy and the corporal punishment that comes as form of disciplining and violence, I tell you, boys experience far more violence than girls in that age group. But boys are to be shaped to become boys, and therefore they experience more violence by their older men and boys and teachers, and they take it as a normal. So violence gets normalized, completely normalized when they are growing up. So working with them at a later age was very difficult, because they didn't see any other alternative model for them. They thought this is, if you take the violence and aggression out of their personality, then they are not left with anything. They only question you, do you want me to become women? And that's something like, is very demeaning, because right from beginning they have been told that anybody who is less masculine is to be looked down upon. So even among the groups of men and boys, who is less of a man is not to be respected, is not to be, so the feminine, any man or any boy who has even a slightest feminine tendencies in the growing up, they are bullied more than even the girls, because so we have seen in the course of all this, that it's far more complex issue. It's just not alcohol, and I was asked to talk about alcohol, but alcohol is only a minor manifestation of all this malaise of how gender is constructed and forced upon these boys and girls in manner that becomes the part of their identity and their being. And I think that's why we need to have more comprehensive collective thinking about this. We need to work within the institutions, first of all. We need to work within the institutions of schools. We have to work within the sports. We have to work within the organizations where men can, when the boys in early ages are coming together and meeting and talking. And then we have to work on issues of empowering women to the extent that they can take these things completely out of their lives. They don't have to be dependent. I think the previous speaker made some very strong points that the women empowerment programs have to couple with the men's program in a manner that while it allows them to converge and draw from each other's strengths, but they should also create spaces for each one of them to explore, because a lot of men are victims of this violence themselves. Gender-based violence I'm talking about. And they need to come to terms with the amount of violence that they go through, and they don't pass it on to the lesser man or women in general, and start growing a more mutually respectful personalities. So I know I'm being generic about it, but all of that, what I'm saying, is coming from a lot of programmatic experience in a large number of programs. I saw Indra Jaising was perhaps there in the morning. We have worked very closely with the implementation of Domestic Violence Act in India in 3 states, worked with the women survivors and police system in judiciary. And one of the major issues that we faced while working with judiciary and police was to deal with this mental makeup of these men who are dealing with these issues while giving verdicts or passing judgments or dealing with domestic violence cases, where they see violence and aggression as a normal part of human lives. They see as something of bonding rather than, 9 out of the 10 cases of domestic violence, they will be advised to go back and live in the family rather than question it. So I'm just wrapping up. So I'm happy to be here. I would be happy to answer any question. I think you have to take a structural perspective on the issue of violence against women and domestic violence, and and it's a long, hard way to deal with this. While we could be very curative, mitigating enough, that need to continue. We have to come and do much more work on, much more deeper work on primary prevention of violence against women from many different points, from many different entry points. I think. So thank you very much for having me here. Thanks a lot.